Welcome to Arirang Live. It's 11 a.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. This is the first briefing of the day, and just before we came on the air, we learned that South Korea has confirmed 18 new COVID-19 cases on Saturday. 12 of the 18 are from here in Seoul, and they mostly originated from a man who visited 5 clubs in Seoul over the holiday weekend. Just one of the new 18 cases is imported, and the nation's total number of confirmed cases stands at 10,840. With no additional deaths, the death toll remains at 256. And over 9,500 people have fully recovered and been sent home. The briefing has just begun, so let's take a listen.
김강립 중대본 1총괄조정관이 진행합니다.
Moreover, we have Mr. Son Young-lee and Mr. Lee Jung-gyu with us for the briefing today. We also have sign language translation available. First of all, here is Mr. Kim Gang-nip on the briefing on the coronavirus outbreak here in the country. Let us now begin our regular briefing for May 9th, Saturday. Today, as of today midnight, we have 18 new confirmed cases, and a total of 1,016 people are still in quarantine undergoing treatment. The death toll remains at 256. And we had one imported cases, and all of the 17 were related to the Yongin patient that have been reported yesterday. There have been 12 in Seoul, and 1 in Gyeonggi-do province, and 1 in Incheon. And regarding to these patients in Yongin, we have 15 people who have been visited the Itaewon Club, and a total of 20 people as of yesterday have been confirmed as COVID-19 patients. The quarantine authorities, in order to curb the further spread, we are currently tracing down the visitors to the Itaewon clubs, as well as the contacts, including the family, friends, and acquaintances of these patients. And we are currently utilizing all possible resources in order to curb the further spread of the virus throughout the community. And we also ask the members of the public to continue to cooperate with our quarantine measures, and please refer to the movement information of these patients that have been disclosed. This morning, Prime Minister Chung Se-kyun presided over a KCC meeting, and we touched upon the issues with the cooperation of the 17 municipalities to secure more hospital beds, and the cities and provinces of Gyeonggi, Incheon, and Gangwon and Seoul. We discussed the measures to cooperate in this matter going forward. And Prime Minister Chung Se-kyun, he also said that regarding the latest cluster infection in the metropolitan area, he highlighted the importance of having swift and extensive cooperation and response. And he said that we need to enable the people to get tested at an early stage. And the Ministry of Health, as of yesterday, May 8th, starting from 8 p.m. for the next 1 month, we have issued an administrative order recommending that all nightlife establishments to be suspend operations for a month. And if they need to be opened inevitably, we also have them comply with the strict quarantine measures. And as we transitioned into the social distancing in daily life, starting from 6th of May, we have provided sub-guidelines for the religious circles and restaurants, as well as private academies. However, they are not legally binding. Therefore, as for the nightlife establishments like the clubs and bars, we saw that there could be some vacuums in terms of quarantine. And so the administrative order has been put in place so that we could put in place penalties and other business cease orders going forward. And we mandate all of these facilities to carry out the body screening temperatures and ventilation. And also after their entry into these establishments, they are all required to wear face masks, and they need to write their information on a visitor log, as well as their IDs need to be checked and verified. And each of the municipalities will be cooperating with the police to see and monitor and crack down whether these facilities have been complying with the quarantine measures. And if they failed to comply, they will be subject to a fine under 3 million Korean won. And if they have been confirmed, there is a confirmed patient, they need to pay for the compensation for the treatment of these confirmed cases and other expenses as well. So we need to strengthen our quarantine measures so that we do not have a second of such case. And in order to prevent and prepare us for the metropolitan areas possible surge in the confirmed cases, we have dealt with the issue of sharing the metropolitan areas hospital beds. And in the Gyeonggi, Incheon, and Seoul city, we have a large movement of people amongst cities and provinces, and we believe that a small infection could lead to a widespread cluster infection. And especially, it could lead to a cluster infection which will be difficult to be controlled by a single city or a municipality. Therefore, we need to utilize all of the resources available at nearby districts and cities and municipalities. And the government, we believe that we will be monitoring the on-day increase of the confirmed cases, and we will be having a 4-stage systems to share the hospital beds in the metropolitan area. Like these days, if we have a daily confirmed patient of below 100, the stage will be lowered to stage 1 and stage 2, and we will designate live treatment centers in these areas. And if the daily increase of the newly confirmed patients increase to over 100, it will be transitioned into the stages 3 and 4, and we need to inevitably share the medical resources among the metropolitan areas. And these municipalities will be having a unified and a big picture of the medical scheme so that they could designate these patients and so that they could be administered at the respective hospitals in other places. And we will also designate live treatment centers and cooperative hospitals to enhance cooperation. And this is aimed at enabling effective use of the limited medical resources. And based on this cooperation model, these will be also available to 6 other municipalities going forward. The virus does not discriminate ethnicities or districts or religions. It is susceptible to everyone, and in order to really successfully deal with the virus, we should not discriminate each other, and we should always remember that we are a single unity and highlight the sense of solidarity. And discrimination and undermining could also lead to significant harm, and it could hinder our quarantine efforts going forward. Moreover, on SNS and online platforms, there are disclosures of the personal information of the confirmed cases, or there are spreading rumors about these confirmed cases, and they become big wounds for these patients as well as their close family members. And as mentioned before multiple times, transitioning to the distancing in daily life does not mean that we are going back to pre-COVID-19 days. And it does not mean that we are free from the virus. However, distancing in daily life is all about striking a balance between our economic routines while having our quarantine measures at the same time. And it is therefore beginning to reopen our economic activities while having disinfection measures going forward. And as we take into our stage of new normal, it is very important to ask for you to stay disciplined and vigilant. And it is of utmost importance that the members of the public be fully aware of the quarantine measures and guidelines and to prevent the fast spread of the virus. And if the spread is speed of the spread is decreased, we believe the government could have a better control over the virus and have a more accurate tracing of all the contacts. And in order to sustain such quarantine scheme, it is very important for the public to cooperate proactively in our measures. Going forward, we believe that the COVID-19 will be prolonged, and we advise all of the schools, sport gyms, as well as religion circles that they could always be prone to the virus. And we believe that the latest cluster infection would be a good test for us, as these could also duplicate in other areas as well. So please continue to stay vigilant and disciplined so that we do not have a further spread of the virus going forward. Once again, I highlight this, but if you have visited the King Club, the Trunk, or the Queen, or other clubs at Itaewon, please refrain from going outside and get screening testings at the screening clinics. And if you have visited the Itaewon area, other than the clubs, we also advise you to have a close monitoring of your health conditions. And please continue to comply with the medical and the quarantine guidelines, including wearing of the face masks. And please refrain from going to religious facilities and nursing hospitals and nursing homes. And please continue to comply with our quarantine measures. In particular, as for the religious communities, private academies, and indoor sport gyms, please stay on alert, and please continue to abide by our quarantine guidelines. And as for the vulnerable centers like the nursing hospitals and nursing care centers, we advise you to stay vigilant as well. Just as you did so far, if you continue to cooperate with the quarantine authorities going forward, we believe that the Republic of Korea can successfully overcome the outbreak. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다. 배석자분들은 단상 위로 올라와 주세요.
There you have it. And now to wrap up the briefing, South Korea has confirmed 18 new COVID-19 cases on Saturday. 12 of the 18 are from here in Seoul, and just one is an imported case. The nation's total number of confirmed cases stands at 10,840. With no additional deaths, the death toll remains at 256. We'll again be providing live coverage of the next briefing later in the afternoon. Bye for now.